but now my tempered glass is broken. I just need to.
So you just have to change the case.
No,
That's much
but
better,
they're like
right?
it makes the phone more slim as opposed to putting something. And
right.
I drop my phone all the time. So.
Me too.
Hi. How are you? That's a cute little thing that you've got the scarf on your purse. Hello, thank you so much for joining us this evening with 11 Alive. We are answering your coronavirus questions. We will begin in just a few moments, but first we're going to do some technical work to make sure that everything is ready and prepared for you guys. We're going to do some microphone checks and then we'll get started. Good evening. Thank you so much for being with us on this Wednesday afternoon. We are answering your coronavirus questions. We want to bring you the facts and not fear. So we have our 11 Alive medical correspondent, Dr. Sujatha Reddy, with us today. She's going to be answering some of the questions that you have been sending to us throughout the week. We're also asking that you go ahead and continue to send us those questions. You can text them to the number. You see it on your screen. It is 404 873 9114. Again, that number is 404 873 9114, and we're asking that you text, not call that number. We'll filter some of those questions and get them to Dr. Reddy to answer whatever questions you might have about the coronavirus. Dr. Reddy, a lot of people are concerned, worried about a lot of things with the coronavirus. We'll get to some of those questions, but anything that you think is very pressing that people should just know right off the bat about this?
You know, I think, like you mentioned, we don't want to be scared. I don't think it's time to panic. I don't think it's time to change a lot of plans. But this is a very fluid situation. And what makes it scary, in my opinion, is that this is a new virus. We don't have a lot of information about it. But the most important thing for people to remember is that 80+% of people who contract this virus have mild symptoms and recover with no problem. So the vast majority of people are going to be okay even if you catch it.
All right, so we're going to get into some of the questions that people have, and we do want to tell you that we will be popping into our live broadcast on 11 Alive here and there, so we do want to warn you that we might have to pause for some of that. But again, please continue to send those questions. That number is there on your screen. Text those questions, and then we will try to get you some answers to those questions. All right, so Dr. Reddy, a lot of people are kind of concerned about this. We're talking about incubation periods because we're hearing about people traveling to different locations, coming back, and then getting sick later. What do we know about the incubation period for coronavirus in terms of how long it takes for you to kind of start showing those symptoms and how long people can be sending it or transmitting it to others?
So that's one thing about the virus I think we have learned is that even if you don't have symptoms, you're asymptomatic, you potentially could still transmit the virus or be contagious. So that is something that's concerning. What we have been seeing is that people are quarantined for about 14 days, meaning if you don't get sick for 14 days, you're probably okay. Or if you do get sick, you're going to wait until you feel better, and then about 14 days from the time you have symptoms or are feeling better. It's a little bit vague there. But in general, 2 weeks is the magic number that we've been hearing for the incubation.
All right, so another question that folks might be experiencing is, I think I have it. Actually, we're going to take a quick break before we get ready to have questions here on live.
Well, the same link will work. It'll obviously change. Give it about 5 minutes. Hit refresh and it should be back.
Hi guys, we are getting a lot of questions throughout the week. We do want to remind you of that number so you can text those questions, not call them to us. We'll be fielding them on our 11 Alive YouTube page. That number is 404-873-9114. Dr. Reddy, Cheryl kind of wondering what kind of questions y'all are seeing from people at your practice.
Yeah, we've been seeing the regular questions like, should we be worried? You know, what do we do if we think we have it? I think that's actually a really good question. I've actually been surprised that more patients, when they come to us, haven't asked a lot of questions, because I think here in Georgia, besides the recent cases, the 2 that we've had, we've really not had that much to deal with here in Georgia. But if you think you have it, the thing to do is, if you have symptoms, get a mask if you're going to be around people, new people in your family. If you have some sort of virus, you've probably already passed it amongst family members, but if you're going to be out, then I would wear a mask. But if you're worried about it, the thing to do is call your primary care or your hospital's ER, whatever you decide to go to, and see if they have the testing kits. We're told that here in Georgia, we do have kits, so they'll have to either be tested at that location or send the specimen out, but we do have kits here in Georgia. But I think calling ahead of time makes sense, because you're going to know what door to go through. Do they have the ability to take care of me? Should I go somewhere else? And I think part of that too is going to be based on how severe your symptoms are. Because if you're really short of breath and possibly have lung problems, you may need to be admitted to a hospital. So then it makes sense to go to an actual hospital.
Some of the other questions we've been receiving, wondering about the coronavirus itself, is it airborne and how is it spread?
Yeah, great question. This virus is spread very much like the flu or cold. It's what we call droplet infection. So if somebody coughs or sneezes, or you're talking to them and they happen to maybe, spittle on you, that is how the virus is spread. It's droplet. Can be in the air. It's passed through an infected person's secretions, as far as coughing, sneezing, runny nose, that type of thing.
Something else that I asked you myself before we got started here, we're in that little change of weather season, people wondering if coronavirus will be impacted by warmer weather, if we won't be seeing it as much, or if we know about that.
I think it's too early to say. Again, this is a new virus, and that's one of the frustrating things about it. But typically, the reason we see colds and flus in the colder climate and colder months is when it's warmer, we're not all in the same facility, all huddled together in the house. We're out and about doing things. And when you're outside, you're not in close contact with people. But in the winter, we tend to be, in our homes, in our offices, and we don't really go out much. And that is why in the winter months we see more colds and flus.
Makes sense. I know we've talked a lot about people washing their hands, cleaning surfaces, in the way they would typically be doing that. But how long can the coronavirus live on different types of surfaces?
Yeah, that's a great question. The best data that we have right now is it probably lives a few hours on hard surfaces. Right now, the thought is it doesn't survive on soft materials, but on hard surfaces, probably for a few hours.
All right, Dr. Reddy, thank you so much. We are going to continue answering your questions right now on the 11 Alive YouTube page. Again, you can text those questions. Please don't call. You can text them to 404-873-9114, and we'll continue to ask those questions for you guys. All right, so we are back live on YouTube. We just had to take a quick break for the show. And so we're going to get back into some of the questions. We did get one of them from our producer. And this one is from Kathy in Marietta. She's actually wondering if distilled vinegar is good as a disinfectant. We were just talking about the surfaces and how long the coronavirus can last on surfaces. Is distilled vinegar an option, really? Do we know?
I think we should stick to what we know is true, and what's recommended right now is using things like Lysol, Clorox, whatever you would normally use to disinfect or clean your counters or your bathroom. That's what I think is safe. We use vinegar for a lot of things. I just don't have any information to say, yes, it will kill the coronavirus. I think if you're worried about it, the best thing to do is use what we normally use: alcohol, bleach, disinfectant, things that you normally have at home.
Kind of a go with what you know.
You got it.
All right, so let's kind of keep it moving with some of these other questions. You did already talk about what to do if you think I might have it. Here's one that's kind of interesting. People wondering if an air purifier will be helpful.
I think that's a hard one to answer as well, because you don't know, depending on your air purifier. You have to look at the size of the filtered molecules that it protects you against, and I just don't know if that's something that we know just yet. I also think it's not really floating in the air unless there's someone that's got the virus and they're coughing and sneezing. But in general, I don't think an air purifier is going to really prevent this unless someone is actively coughing and sneezing in that room.
What about folks who are going out to the gym? We have a question about whether or not they should stay away, or what practices they should take if they are a regular person who's in the gym pretty much every day.
I think exercise is vital for your health, so I would not at this point change your routine. But I think you may want to think about talking to your neighbor on the treadmill or the elliptical. What's recommended right now to protect yourself is to keep a little bit of personal space, like what we're doing here now. But keep a little personal space. About 6 feet is what we think that droplets or the virus can kind of jump person to person. So if you're able to do that as much as possible, I think that's going to protect you. Again, I don't want people to panic. I don't think we should change our lives. So if going to the gym is important to you, maybe you go at a time when there's less people, but just try to maintain your personal space.
Yeah, and it's always a good idea to kind of wipe that stuff down when you're over there,
well,
regardless, right?
I hope people are doing that even when they weren't worried about the coronavirus.
Give me just a second. We're going to take care of some technical issues.
Sorry, we got to switch sides here.
Okay, no problem. I'm just going to fix my mic here. All right, we are back. We just needed to take care of some audio issues to make sure that you can hear what we're saying and get this information. Again, we want to give you the facts about coronavirus, not fear. Again, that number that you can text your questions to is 404-873-9114. We are getting those in and asking them of Dr. Reddy, our 11 Live medical correspondent. And I'm actually checking my phone because I'm getting some of them right now. So here's one for you, Dr. Reddy. Can you get the coronavirus from touching groceries? Do we know that?
So what we know so far is about how we talked about what lives on live surfaces. So as far as we know, the virus lives on firm, hard surfaces for a few hours. So I think the key that we've been hearing all week and really for the last several weeks is wash hands, hand sanitizers. You know, I will tell you, I keep a bottle of hand sanitizer in my door of my car. So when I get in my car, I sanitize. And that way, whatever I've touched outside, you're going to be protected against. So I think it would be possible if someone sneezed on your cucumber and you touched it, it would be possible for that to have virus on it. So again, if you can avoid touching your nose, eyes, mouth, sanitize often, you should be in good shape. If you think about produce and things at the groceries, you put those in a plastic bag, that would protect you. Yeah. I think, again, it's just going to be a little bit of practicality and just being a little cautious, but I think we'll be okay. And
speaking of sanitizer, just to remind folks, what kind of hand sanitizer do they need to be looking for?
Yeah, the ones that you can get at the store, like the regular Purell, anything that's made with like isopropyl alcohol is usually the main ingredient. You're going to do fine. They're really pretty standard nowadays.
Okay. Another question we have, and I'm not sure how much you've got with this one, Dr. Reddy, but if this person wants to know if your employer can punish you for being in quarantine and unable to work. I think a lot of folks are concerned about if that happens to me.
Yeah.
And we were talking about being quarantined earlier because it is about 2 weeks.
It's about 2 weeks.
So,
you know, I think when we have all this public health information out there, I would like to think employers would acknowledge that and protect your job. I unfortunately can't answer that because that's going to be based on a case-by-case basis, but I would think it would be very sad if someone lost their job because they were under quarantine when you're being told by public health officials that's the right thing to do.
Yeah, and I'm sure there'll be more than ample proof and, you know, documentation for someone who would be in that situation.
If this, you know, spreads, we're going to see those situations come up.
Another question we have, and this is, I guess, especially interesting given the case that we are seeing people who are traveling and then coming back from certain locations who are showing those symptoms. If you are contagious, or whether are you contagious if you're not showing those symptoms?
Yeah, and that's a really good question. And the answer is we think yes. Right now, we do feel people have transmitted the virus without symptoms. And that is one of the scary things about this new virus, because the minute people show symptoms, we're able to quarantine them. But prior to them having symptoms, they've been out and about, and I think we are seeing that be the case of some of the spread that we're seeing now in America. So yes, you can transmit the virus without symptoms.
All right, so how long does it take for this new coronavirus, COVID-19, to run its course once somebody is determined to have had it?
Yeah, so once you're showing symptoms, it's going to depend on how sick you get. I mean, for the people that end up in the intensive care unit, obviously it's going to take them a long time to recover. For the most people, though, like we mentioned, 80+% of people get a mild case, recover like a simple cold or a virus, and seem to do fine. But we know the quarantine period is about 2 weeks, but how long you're going to have symptoms is going to depend on how the virus affects you.
And we've seen that other people with respiratory issues already that are already pre-existing, that this is hitting them more than others, and that they're also at higher risk to get it in the first place, correct?
So what we're seeing with people that have pre-existing like chronic health conditions, things like heart disease, lung disease, we're seeing that they seem to be getting the more severe complications of the virus. So again, 80% of people that get coronavirus are going to get a mild case, recover fully. Close to 20% may get more severe symptoms, and a fraction of a percent of those are going to die of their symptoms. And what we see to be a uniform thread is that people that get more sick and are dying of this virus typically are people that have some other medical problem. Older people commonly have multiple medical conditions, and that's what we're seeing. Now, could there be one case of someone young and healthy succumbing to this? Yes, but that's going to be rare. In general, most people are going to survive this and have no problem.
Okay, I want to go back to something you mentioned earlier. We were talking about masks, and there has been a lot of talks about masks as we've been discussing coronavirus. People saying everyone doesn't need to run out and get them, that kind of endangers the supply for medical professionals. What do people need to know about masks? Who should be using them?
And that's a great question. Well, first I'm going to tell you is I was in the hospital. I did surgery this week, Tuesday, yesterday, and we have our regular surgical mask that we're using for our cases. So nothing has changed there. So it's not like for medical professionals they're telling us to do anything different. I think that's important to understand. We're doing the same thing we did a month ago. Having said that, what's being recommended now is if you have symptoms, cough, fever, you've been in a coronavirus area, you're worried about having coronavirus, you think you may have a flu, you wearing a mask will protect the people around you. For people that are living their lives, having no symptoms, have no known exposures, wearing a mask may not help you. We don't think it will. The kind of mask that they're recommending if you really want to protect yourself, or if you're the one that's already sick, are the really cumbersome big masks with those two air vents, and they're called N95s or R95s. And those are not masks you can easily walk around and live your life with. So in general, masks are not recommended. I did see a couple of things on the news where people were talking about children. And if your child is very nervous and they want a mask, you know, if it makes them feel better, I don't think I would say no. But I think for the vast majority of people, you do not need to have a mask.
And it's more so for people who are sick to keep from the spread.
You got it.
Okay, that's some good information out there. All right, we were also talking about this one before we got started. A lot of folks getting ready to travel. It's spring, the weather's starting to change a little bit. What are we hearing about in terms of guidance for people traveling, both domestically and internationally?
Yeah, I think for domestic travel, we've had no changes, no restrictions. I think you just have to take it on a case by case and how comfortable you are. I think that's a personal choice. For international travel, I absolutely would listen to the warnings. I would not travel to where we've been told not to travel to. China, Italy, parts of the Middle East, South Korea, parts of Japan, they're saying be cautious. So I think in those instances, I would not travel there. What's very interesting about this situation we're in is that it's very fluid. It's changing a lot. You know, Italy was not considered to be a problem until a few weeks ago. So I think if you're going to have a trip, and you know, we plan these vacations and major trips around occasions, and you know, we plan them for months and months. Just be warned that if you travel hypothetically, I don't want to pick any place because then people might think that's a dangerous place, but you're going to go somewhere. And right now it's okay, there are no coronavirus cases. If you're on a 1 or 2 week trip, that could change. And then you may not be able to get back home on time, you may not be able to do activities there, so it could change your trip. So it's really hard to give people advice because we just don't know, and things are changing all the time, but I understand the anxiety.
Yeah, certainly. All right, here's another question. This one is from Margaret out in Chamblee. We're trying to tell who asked the question and where they're from when they're providing us that information. So if you don't hear a name or location, then the question was submitted anonymously. But Margaret from Chamblee says, should your water be hot or cold when you're washing your hands? And then also let's remind folks about the proper way to wash your hands.
Yep. So you want to wash your hands. We were talking about this, and thank you, Margaret, for the question. You want to wash your hands singing the Happy Birthday song. That's the right amount of time. And I would wash your hands in a water temperature that's comfortable. It's not the water that's killing the virus, it's your soap.
Okay.
So whatever temperature is comfortable for you, I would imagine like a warmish water would be comfortable because you're going to be doing it for that whole Happy Birthday 20 seconds. So something that's comfortable, but the soap is the key.
All right, so you don't have to scald your hands under the water.
Please don't.
This one coming from Rob. He says, what medicines are being used currently to treat people with symptoms? Do we have
that's a great
on that?
question. Thanks, Rob. So right now there is no true medication for the coronavirus, and that's one thing that separates it from the flu. We do have medication if you catch the flu early that may prevent you from getting very sick. We don't have that with coronavirus. So right now what people are doing is whatever symptoms you're having, we're treating those. And again, for 80+% of people, those are mild symptoms, low fever, cough, and if you get that, then you know you're going to take your over-the-counter medications to make yourself feel better. But that's about all we have right now, and that is one thing that does separate the coronavirus from the flu. We have things that can prevent the flu, like the vaccine. We have medications to treat the flu, but we don't have that for corona.
All right. I did want to ask you about the survival rate because, again, we are trying to make sure people have facts, and anything that's unknown can be very scary and very concerning. But when we're talking about the survival rate, is it kind of rather low?
No, actually,
No?
the survival rate is actually very,
I'm sorry.
very high.
I meant
yes,
mortality rate. Thank you, Dr. Reddy. The mortality
survival
rate seems rather low comparative.
Correct.
Thank you.
We, a couple weeks ago, did a thing comparing this virus to SARS, MERS, and the flu. The mortality rate right now is low. Again, 80+% of people will get a mild case and survive just fine. And we are seeing that the deaths are in people that have that underlying medical condition. Older people that have health conditions especially seem to be more vulnerable. So again, the coronavirus is very survivable. The mortality rate is very low. Right now, our best guess is it's about 2%. But I think that number may actually drop, because I think as we learn more and more people probably did have the virus but never got tested because they really didn't get that sick, I think that mortality number will go down. But right now, it is not as scary as something like Ebola, in my opinion.
What about people who might be expecting right now?
Yeah, that's a really good question. Right now, unlike the scary thing for me was Zika a couple years ago, corona doesn't seem to be any more dangerous to pregnant women. And actually, we have seen that there seems to be some way that children are protected, because the infection rates have been very low for children, which is good. Because we commonly say for flu, watch out for than 6 months and elderly people. So far with coronavirus, it seems to be mainly the elderly. But for pregnant women, I would just take precautions like you have been to protect yourself against anything else, because we know pregnant women do have a little bit of a suppressed immune system. But right now, there's nothing specific about pregnancy that makes pregnant women seem to be more vulnerable at this time.
What about other chronic conditions? I know we talked about respiratory issues, but what about other chronic conditions that people may have? What kind of impact do we know that the coronavirus is maybe having on those?
Yeah, so if you happen to catch it and you have these chronic medical conditions like heart disease, lung disease, those are the people that seem to be the most vulnerable to the serious complications.
Okay. Someone, I think, asked a question when we were talking about travel. This was an anonymous one. Does recycled air that we hear about with planes, does that impact your risk for coronavirus as you travel?
You know, I've heard stories about airplanes for a long time, like, you know, there are germ magnets, germ factories, but think about how many times we do fly and don't get sick, and there's always someone that's coughing on the plane. Recycled air is not ideal. I know they have some kind of filtration system, but here I think we know this virus really is transmitted person to person. So I don't think the air on the airplane should be any more of a concern with coronavirus than it is with any other regular cold or the flu.
Okay. Let me ask you about pets, because the pets are members of the family for so many people. What do we know about whether or not our dogs or cats or other animals that we love and care about are susceptible to coronavirus?
Yeah, you know, I don't have that information if your dog or cat can catch coronavirus. I'm not sure if it's unique to people, but so far from what we've seen, domesticated pets have not seemed to have been a way to transmit this virus, which I think is important to know.
All right. I think you kind of touched on this one, but I'm still going to kind of ask it.
Fire away.
Should I worry about packages coming in from other countries? And we talked about the surfaces, but just to kind of reiterate and remind.
Sure. We think on firm, hard surfaces the coronavirus can live a few hours. So what I would do when I've gotten my Amazon packages this week and last week is you go get your package, open it up, take your stuff out. I put that box in the garage, and I'm going to wash my hands or sanitize. I think the key is, you know, could your UPS carrier have had something and touched it and then you got it? You got to be a little cautious. So I think washing your hands as much as possible is going to be key. But it's highly unlikely that if something came from China, it's going to survive that journey and be with you.
All right. This is another question we're just getting in. Why haven't they found a cure? Why is it taking so long? What's the process?
So when we talk about viral infections, it's rare that we ever have a cure, because viruses are the type of things that our immune systems make antibodies to. What we're looking for from our medical pharmaceutical companies and researchers now is a vaccine, but that will only prevent infection, and hopefully medication, some sort of antiviral aimed specifically at the coronavirus that may help your body fight or build up the antibodies quicker. So to think about a cure, most people that get the coronavirus will recover, and then because of the way our immune systems work, they should never catch it again, which is another myth I heard recently. So once you get it, you should be protected from this particular strain. So our bodies should be able to fight the infection and cure us of it. So we're looking for treatments and we're looking for prevention in the form of a vaccine. But you know, when we're talking about a vaccine or medications, you want to make sure it's safe, and that's where the testing often can take months.
All right, here's another one for you that just came in. How long might this be a concern for travelers? I think we're getting some travel questions since we touched on this topic, and like I said, it is that time of year. people getting ready for spring break and things of that nature. How long might this be a concern for people who have plans or maybe are hoping to make plans?
Yeah, and that's a hard one to answer, but I think this is going to be an issue for us for the next few to several months. Again, it's very hard to predict, but I think this is not something that's going away in a week or two.
So we've been talking a lot about coronavirus. Let's just kind of reset a little bit. I want to give you guys the number again that you can text your questions to for Dr. Reddy. That number is 404-873-9114. That number should be there on your screen. Again, it's 404-873-9114. And we're asking again that you text those questions to that number. Don't call it, and we'll try to get your question answered by Dr. Reddy. Something that folks have been concerned about is products to disinfect their home and these surfaces. Aside from the hand sanitizer, what are we looking at in terms of maybe like Lysol or bleach, or what should people be kind of looking for to make sure that their homes are as clean as possible?
Everything you just mentioned. I think what you normally clean your home with, what you would clean or sanitize your bathroom with, is what you're going to use. I'll tell you, in our office and in the hospital, nothing has changed. We're using the same antibacterial, antivirus wipes, disinfectants that we've been using. So nothing new or special specifically for coronavirus, just the stuff you normally use. The coronavirus has been around for quite some time. You know, it's relatively a new virus, but we've been dealing with it for decades. This particular one obviously is a new strain, but we've been dealing with coronavirus for a long time. There's so many different strains of it. People may remember the SARS outbreak, the MERS outbreak. Those are all different strains of coronavirus.
All right, that's a good point to know. Let's kind of remind folks of the symptoms that we're seeing, and they're very familiar.
Yeah, so the symptoms of coronavirus are very similar to what you might think if you get a cold or a bad upper respiratory infection or the flu. You're going to look for fever, cough, and any problems breathing. Those are really the symptoms that we're going to see.
Okay, and what kind of differentiates coronavirus from the symptoms that we might experience with a cold or the flu?
So they're very similar to a cold, like I just said, but then for the flu, what we typically see if you get influenza is you more commonly have more body aches.
Okay.
We're not seeing that as much with coronavirus, which is why I think people can have it and not really realize. And again, 80+% of people are going to have a mild infection.
Okay. Somebody wondering if the coronavirus, once you get it, will stay in your body similar to something like mono.
So what we think with the coronavirus, since it is, we have had experience with previous coronaviruses, we think once you catch it, your body's going to make immune cells to it, antibodies, and you should have immunity to it. But so far as I can look from the other coronaviruses, it should not be something like the monovirus, which is called Epstein-Barr. It should not be like that where it's going to be chronically in your system, which for most people Epstein-Barr isn't, but some people it can, but we've not seen that with coronaviruses up till now.
And you kind of touched on this one earlier, but I'll ask again from this person, what or is there any treatment?
So there is no specific medication for the coronavirus. What people are doing when they're getting sick or having symptoms or in the hospitals, we're giving what we call supportive care. You're treating the symptoms that they're having. For the people that have gotten respiratory problems, which is where we seem to see the most severe complications, if they're really bad off, they might need to be on a breathing machine. You're treating the things that come up. So for people that have a fever or a cough, you're going to take your regular over-the-counter medication to make yourself feel better, treat the symptoms, but we have no specific medication just for coronavirus.
All right. You touched on this one as well, but we do want to answer the questions that you guys are sending in. How does coronavirus affect children? What are we seeing there?
Yeah, that's a really good question. Luckily, from the data we have, children seem to be naturally protected. That's just our best guess because the numbers for children have been very small. When you look at the overall, about 90,000 people, the percent of children has been very tiny. And the serious complications so far have not really been seen in kids. So kids seem to be protected, which is really good because they're often the most vulnerable. And if you see children or have children, they share germs with everybody. They're wiping their nose on everything. So it's a good thing because they're going to be the ones that will share it. You got it.
All right, so another person wondering, is it safe to go to your doctor's office and be in such close proximity with others right now as we're experiencing this in time when people are concerned about coronavirus?
Yeah, and that's a really good question, and we worry about that with regular influenza as well. And so again, I think if you're the person with symptoms, if you go to your doctor, I think the best thing to do is call ahead of time, make sure they're able to take care of you. Sometimes they'll have the sick room like we have in pediatrics offices They may bring you a mask outside. You know, there's going to be different things that are going to be done. But I don't want to deter people from going to the doctor if they need to go. And I think here I wouldn't sit next to somebody in the waiting room.
Yeah.
I would get some space, maybe one end of the room to the other. We as medical care providers, we're very cognizant of this, and we're asking patients if they have active symptoms to let us know, call us ahead of time, or perhaps we have to send them somewhere else. So we're very aware of this, but I think that is a really good question. But I think that's the same for going to your office, or wherever you have to work. I think we have to be very vigilant, keep space. If you're a person that's not feeling well, try to stay home. Hand sanitizer, wash your hands, and I think that's the best advice. But I think we have to just maintain that 6 feet boundary as well as we can.
And you mentioned calling ahead. If someone thinks that they have the symptoms of coronavirus, what's the best advice for them to go about getting treatment and finding out what's going on?
Yeah, I think the first thing you do is either call your primary care provider or call your urgent care or your ER and find out, do they have the ability. I think a lot about where you have to go is going to depend on your symptoms, how sick you are. If you're having shortness of breath, definitely go to the emergency room because we need to get you taken care of. And you don't know that it's coronavirus. You could be having a severe other kind of problem, like a severe asthma attack or something like that. So depending on your symptoms, that's what you're going to do. But I think calling ahead is going to give everyone a chance to prepare, and you're going to make sure you go to the right place, because the last thing you want to do is go to multiple places and not get the care you need. So calling ahead. But I think, again, we don't want to panic. There's still far more influenza out here than there is coronavirus in Georgia.
All right, so here's another question that we have coming in, wondering about different surfaces. I think a lot of folks are concerned when you kind of go to places where the germs seem to be concentrated, like the gas station.
Yes.
So what about the gas pump? I know sometimes people will kind of get the paper towel before they handle the gas pump. Is that kind of a good idea just in general, but especially now when we're kind of concerned about germs especially?
Yeah, I mentioned earlier, I have a bottle of hand sanitizer in my door, and especially after pumping gas, I use my hand sanitizer. I think if you have any sort of regular mittens or gloves, you could try to do that, but I don't think I'd be any more fearful of the gas pump than I would be your office phone or your office bathroom. I think we just have to take precautions like hand sanitizer. If you can get those plastic disposable gloves, maybe you use those, but I don't think I'd be any more fearful of the gas pump than I would be a public restroom.
Anything like a door handle when you're going, it's the same thing there. Someone asking, can coronavirus be transmitted through an HVAC system, for example, like in a hotel?
Yeah, so far we've not seen that be the case. That's a great question. I think if that were possible, we'd be seeing this spread a lot more quickly. So far, it seems to be person to person. It's a droplet infection like you would expect with colds and flu. It does not seem to be like Legionnaires spread through the HVAC system. That's actually a really good question.
Well, we didn't have a name on that one, so we can't give you credit. Someone asking, what is the possibility of coronavirus spreading, maybe like an infection rate?
It's hard to answer that because, again, it is relatively new. I think we all are seeing the numbers and we're seeing the cases spread. I think part of that is that we know that the virus seems to be able to be transmitted before the person even knows they're sick, the asymptomatic viral shedding. Someone who doesn't have symptoms, doesn't know they're sick, just doing their daily business, like going to the office, going to the bank, going to a restaurant, that could potentially spread the virus. So I don't want anyone to panic, but I do think we're going to see this spread more before we get control on it, so to speak. I think it's going to get worse before it gets better.
Some folks wondering how prepared our hospitals might be for receiving patients with coronavirus.
I think that's going to depend on the hospital. I can tell you that we've had talked about this. We've had emails about it. We have signs up in the hospital and in our offices. So, we have some amazing healthcare facilities here in Atlanta. I do think that the big hospital systems are well prepared and dealing with this. Several years ago, we had patients with Ebola here in Atlanta, and we were able to handle that. So I think the hospitals are ready, and I think they're prepared.
And this is something that they kind of train for at various points in times as well.
You're exactly right. We have drills and practices, and they're in constant touch, and we're lucky. The CDC is down the street, so we're probably some of the places that have the best access to information, and it's just a drive down, so we probably get stuff more quickly than other people.
Something else, another person wondering, what should you do if you know someone who travels a lot and is showing symptoms?
So I think it's going to depend on where that person has traveled to. Obviously, if they've traveled to a place where there is virus, I would be concerned, but I have a feeling they'd already be on a public health watch list at that point. But just because we travel a lot doesn't mean you're going to catch this. It has to be traveling to a place where a person has it or running across a person. I think at this point, I don't think I would be too concerned unless that person has been to a place where there's known virus. If they're showing symptoms of any sort of like cough, cold, fever, they may want to just go get checked out. One way that I think prior to having testing kits be available in a lot of places, the way they were kind of thinking someone may have the coronavirus was to rule out the regular flu. And those tests are readily available. So, and odds are that person does have the flu.
Let me pause right here, Dr. Reddy. We're about to go live at 6 o'clock.
Okay.
Hi, everyone. Dr. Reddy and I just paused a question in our live YouTube answer session. Again, we do want to give you that number so you can share those questions that you have for Dr. Reddy. It's 404-873-9114. And, of course, you can text those questions and we'll try to get to them. Dr. Reddy, some other people wondering about asthma and allergies. Should people with those conditions be more concerned about coronavirus?
People that have asthma, that would come under that chronic healthcare kind of thing that we worry about when we said people have chronic conditions or serious medical conditions, or we've heard the term predisposing conditions, and asthma would be one of those because your lungs, if you're asthmatic, your asthma can get flared up if you have an infection. So if you have asthma, just like you are more prone to serious complications of any cold or flu, you may be more prone to serious complications of the coronavirus. Having said that, again, only a small % of people get the serious complications. Most people with coronavirus recover fully and easily.
All right, you've touched on this one too, but we're going to ask it again for the folks that are at home. Can you get coronavirus twice, or are you more immune, or are you immune at all after the first time?
Yeah, to the best of our knowledge, looking at other viruses in this family, once you get this virus, this new COVID-19, you should not catch it again because your immune system has generated antibodies. If you get exposed to the virus, your immune system sees it, the antibodies attack it, and you should not get sick again. So just like with other viruses like the flu, you should not get this twice.
All right, some folks wondering about testing for this. Can you detect coronavirus from a blood test?
So there are testing kits, and we have some in Georgia. They made a mad push to get them out to as much places in the country as they can. And the way you're going to get tested is either through a swab of your mucous membranes, your nose, your throat, and possibly through blood, looking for antibodies and or the virus.
All right, Dr. Reddy, thank you so much for being with us. We're going to continue our conversation on our 11 Alive YouTube channel. Again, we do want to remind you of that number that you can text any questions that you might have. That number is 404-873-9114. Again, we want to get you the facts, not the fear about the coronavirus situation. So you can text those questions, not call, and we'll try to get answers for you. Okay, we are back live. Let's just kind of reset and remind folks about the general information that folks need to know about coronavirus. Let's start with the symptoms that folks should be on the lookout for.
So the symptoms of coronavirus are very similar to a cold or flu. Commonly we'll see fever, maybe a cough, maybe some shortness of breath, but I think that's a tough one because if you get shortness of breath, you have to monitor yourself pretty carefully.
And what should people be doing if they or someone they know is experiencing these symptoms, if they maybe think they've been traveling or they might be at risk of having caught coronavirus?
First off, we know still in Georgia, your risk of having coronavirus is pretty low. But if you're worried about it, the thing to do is contact your healthcare provider, your local emergency room or urgent care, and ask them, I'm worried about this, what should I do? Commonly, and we were talking about this before our break, is before we had widespread testing available, they would eliminate the flu as a possibility, but the majority of people with these symptoms are actually going to have the flu. So, you know, if you don't have the flu, then you go into that bucket of possibly having coronavirus, and then they may, based on your symptoms, test you and go from there. But again, you want to make sure you're in a place that can handle that.
All right, let me check my phone, see if there are any other last questions. I'm not seeing any just yet, but I did want to reiterate for folks at home. We were talking about the mortality rate, their survivability. Let's just remind folks what we know so far about coronavirus when it comes to that.
Which is, I think, good news, because this is scary, because it is a new virus, and you know we're hearing these cases into the 90,000 is a lot of people. But again, 80+% of people who contract the coronavirus have mild symptoms and recover fully. A small percent get serious lung infections, complications, and even a smaller percent are the ones that we're seeing, it's so sad, but they pass away from it. And typically that have been people that have had other medical conditions that may make them more prone to complications with their lungs, like pneumonia, respiratory distress syndrome, things like that. But again, the majority of people who get coronavirus do well.
All right, Dr. Reddy, thank you so much for your time, for all of your knowledge on coronavirus. Again, guys, we really do just want to give you the facts and not the fear about this situation. So we will continue to cover this for you thoughtfully and try to provide you with as much perspective as we can as we continue to go through this situation. Remember, you can always reach out to us with any questions or concerns you have, and we'll do our best to get that information to you. You can always reach out to us on our social media platforms. And again, that number you can text. We'll still continue to monitor it. It's 404-873-9114. Thank you so much for being with us.
Thanks for the great questions.